With the first day of spring right around the corner, hallelujah, many people are making plans to get outside. Doing so without the proper protection could be dangerous for your health, as there is a growing risk of a tick-borne disease. It's called alpha-gal and can cause an allergy to red meat. In 2023, the Centers for Disease Control and Prevention estimated more than 450,000 Americans have developed the allergy, making it the 10th most common food allergy in the U.S. Our Dr. Wayne Tuckson discussed the topic on the most recent episode of KET's Kentucky Health.
What is alpha-gal syndrome?
Well, it's an allergy to a carbohydrate, which usually you're allergic to a protein when you eat a food, or an environmental allergen. But with this, it's a carbohydrate, a sugar, and it can cause any number of allergic symptoms in the patient. And one of the weird things about it is they can be quite delayed. So that's what trips up a lot of diagnosis processes, is that someone might eat steak and 6 hours later throw up or have a rash, and so they don't even really think it was related to that meal. So it can be a pretty tricky allergy to diagnose.
But are the symptoms specific enough to say, hey, this is alpha-gal syndrome, or are they so kind of nebulous that it'll throw most physicians off track?
If you're not thinking about it, yeah, you won't diagnose it because the huge spectrum of symptoms can definitely fool us. Yeah.
What's the time limit usually from time of infection to the time of presentation?
So from the tick, tracing back to the tick bite, I don't know if it could be days.
I've seen
to
about
weeks.
3 weeks is
the
most common onset of symptoms is 3 weeks after a tick bite.
Now, you keep saying tick bite, so what tick and what does this tick look like?
It's a Lone Star tick.
Lone Star tick. It is the Lone Star tick because it comes out of Texas?
You know what? I think they call it the Lone Star tick because it's got a little white dot on its back, but I don't think it comes from Texas. It's more prominent in the southeast and in New England area, actually.
Are there other, insects that can now give us this kind of disease presentation?
There's some studies that suggest that chiggers may actually transmit alpha-gal as well. Yeah.
It's always nice to stay out of the woods now, I guess. I'm going to stay in concrete plazas. To that end, what can we do to prevent us in getting infected? Is there anything?
Well, I tell everyone, for a lot of reasons, Lyme disease and ehrlichiosis and various tick-borne illnesses, be very careful out there in the woods, especially in the summer months. Tall grass is really a classic place where you'll pick them up. Watch your animals. Maybe treat your animals, but they have socks and other clothing that's supposed to repel ticks. But I mean, they're tricky. They can climb on anything, and so yeah, I think prevention in that respect is probably the best.
Well, for more of that conversation that might make your skin crawl, but it's good information to have, you can stream the full episode of Kentucky Health and learn more about alpha-gal, including how acupuncture is being used to treat the disease. Watch it online and on demand at KET.org. And be sure to look for future episodes of Kentucky Health Sundays at 1:30 Eastern, 12:30 p.m. Central, right here on KET.